We have an agenda today, a loop based on our best ideas, and we may at some point have a special guest or not. It's like really we don't know. We don't know. We have no idea actually.
Right. Okay. Welcome to the Health Tech Talk Show, where interoperability meets a budget operation with the world famous host, the capitalist queen herself, Kat McDavitt. And our Share Bear socialist, Lisa Bear. So sit back, grab a drink, and enjoy your end of week roundup.
Oh my God, dude.
Cameron himself.
Unfortunately, we still haven't stopped thinking it was funny. Like, we still laugh every time little listeners watch.
Such a good intro. Oh my God.
Hello,
America. Here we are. So we have a lot going on today, but we also have real legitimate guests who you'll see here in the corner. KODY Kinsley, most recently Secretary for Health for the great state of North Carolina, and he's going to tell us some legitimate things. And he came prepared, looking just like me and Lisa with this incredible mustache over here. So I don't know what's going to happen, you guys. Well, KODY, say hi to the crowd, and then we're going to kick you off and bring you back.
Yeah, amazing.
He's great. He's amazing. We love that guy. Okay, all right. We're kicking you two off. Lisa, holy shit. What happened this week? Just as much as last week, kind of.
Where do we even get started? I don't even know.
Just right here. This is where we're getting started, right here on this eagle.
Getting started. Yeah, the thing is, everyone, if you've been a fan of the Health Tech Talk Show since the early days, which apparently were 2023, which is kind of insane, you know that we have been a fan of the Eagle and of the America for quite a long time. It's not a new thing for us. So while you might think that we are pandering to the new administration, this has been our look and feel for the entire time.
Yeah, I just want you all to know, loyal fans, like, we are always pro-America. We are always pro-Eagle. We are always pro-flame and fire. Although I don't think we are always pro taking over Gaza, but like, I mean,
no, I'm actually not. I'm not pro that.
If we do, if we take over Greenland and the Panama Canal and Gaza, I listen. I'm just gonna make the best of it. I don't think we should, but if we do, open arms.
I have the most pedantic point about taking over Canada, and this is
right.
only.
I forgot about Canada. Yeah,
I'm probably the only person who would care about this, but like, Canada already has states. Like, it's not just Canada, right? They're called provinces. And so I really feel like it's not appropriate to say Canada will become the 51st state. Like, I'm sorry. They have their states inside of Canada. So we'd have to add a bunch of states, the provinces. Not saying that they want to be part of America, the United States of America, rather. They are part of North America, obviously. But, you know, just pedantically, I'd like to point out that there are multiple parts of Canada. So it's just one big Canada.
Also, my friend Bill Charnetsky, who is a Canadian from Point Click here, he tells me that only part of Canada is a blue state.
Yeah, that's true. Like, Manitoba is like not. Like, there's a lot of cowboys, literal cowboys in Canada. Just saying.
Yeah. So I don't know. Anyway, there's a lot going on this week. But you know, so we got some special things going on for you, loyal fans, in addition to our very legitimate guest. But we're gonna go through some news that we heard about recently. And then we're going to do an educational presentation from Lisa Berry, and then we're going to get to some real stuff. So, Lisa, so just like recap of the whole federal worker reduction in force, ultra riffing.
Man,
we had this email. We talked about this email last week, Lisa. We're going to go through the facts, and then you're going to Lisa explain. Hold on, you wait. Then the day before this was supposed, the resignation offer was supposed to end. There was all this news about workforce ranking, all workers on probation, rank your low 40s, right? Like, Jesus Christ. Like, this is like, I mean, hello, private sector. So, I mean, that would scare you into replying resign. I was like, that's like a pro private sector douche move. Like, I'm here for that, except it's douchey. And then we also heard the White House is preparing that executive order to just cut a bunch of people also at HHS, I think specifically. So, I mean, this would make a lot of people hit resign. So, and Lisa, I don't think I have it in here, but you also posted a great graphic this afternoon about how it's actually not a lot of people in the overall federal workforce who have hit resign. So
No,
it's your turn to tell us what this means.
Yeah, we don't really know, obviously, what's happening inside, but like basically there's about 2.3 million federal workers, about 150,000 retire each year. And someone is reporting like 60,000 have pressed resign. Of course, I also read that some of those people who pressed resign, people work at the IRS, and they were told like, LOL, you can't resign, you're like essential workers. So there are some details that like don't really add up, and I don't think we really know what the plan is, but I don't think this is going to get them. I think that, it's going to be a process, and certainly people will leave over time. But like at this point, we're not seeing like a bunch of people leave, although plenty of agencies are being put on pause or being put on furlough or whatever. So TBD how it plays out. The thing again, like from my perspective is like, okay, you want to, work on like fraud, waste, and abuse, like, where there's a huge amount of money is the Department of Defense, and a lot of, Department of Defense has like failed like successive audits for years and years.
Lisa, we're taking over Gaza. We need lots of defense.
Sorry.
I mean, even Canada might put up a little bit of a fight. I don't know. We can't cut defense. We can't do that.
Canadians, just for legal purposes, Kat is joking.
I'm joking. A lot of people don't get my humor, and I get
Canadians please, we love you. We want to be friends. Like we're not.
I do love freaking Canada. Canada, you guys are great. You keep me on the up and up. Yep. So anyway, yeah. But I will say, Lisa, on this thing, it's like overall, it's like 65,000 or whatever. If I was a federal worker who was going to get hit resign, I would not hit resign until I wouldn't do it at the last minute, because you never know, the shit's going to break. It's like sending in an RFP. You don't want to send that shit in on time. You want to send it like close to the deadline. Yep. So my guess is that with all this drama, they will see more people do it, but I don't know, loyal fans. I don't know. We'll see what happens. But speaking of people uninviting themselves to their jobs and whole agencies getting unalived, USAID did get unalived this week, which was sad. This was their website from last night. Yeah. I'm not officially, but Lisa, let me use my new Gen Z terminology. Jesus Christ.
All right.
So,
sorry.
Anyway, I don't know what happened today, but I was, last night I pulled this. This is the USAID website in full. Like there is FAQs last night as of like 8 p.m. Eastern time. The FAQs were 1. So this is the whole page. This is the whole website. Not great. America, not great.
Yeah. It's not great. And also like, I'm not qualified. I'm not qualified to opine on this, but I'm going to do it anyway, because why not? And like, I would just say like, yeah, I can see arguments as to like independence for agencies or whatever, but also you can see how these activities could fall under the State Department. But like all of that aside, like, the work USAID was doing is pretty important. There's a lot of people, there's a whole story about like people who are like in the middle of clinical trials that are like being supported by USAID in other countries, have like devices in their bodies. Like that's not a great way to make people happy about what America is doing. I feel like it matters for America how other countries perceive us, and it is important for America. Like we don't want people to like hate us everywhere. Just some thoughts, and and like just some thoughts on orderly wind downs of activities and things like that. But I would not want to be one of these people who's like posted in South Sudan working for USAID, and they're like, what? What's happening?
Sorry,
not great.
Whoops,
not great.
Yeah, we don't need you anymore. Thank you for your service. Like what? I don't know. I did listen to that Wall Street Journal podcast you told me to listen to last night on my way home, Lisa, and yeah, I thought it was good. The only thing is like what I don't understand. It was also like incredible how they were presenting Elon Musk. They were like, he's gonna get the fall for all this bullshit, but he doesn't care. Like it was like pretty.
But he doesn't care because he's the richest man in the world.
He doesn't care.
So what does he
give a
care?
shit?
Exactly.
Yeah,
exactly.
I mean, whatever. Like what a great fall guy. I'll tell you what. Like if only. Yeah. One day I hope that I'm that rich that, I can also not care if the entire world hates me, but like, whatever. I also listened to that and thought those things while driving my Tesla. So
amazing.
I don't know.
Same.
Yeah. But I mean, the other thing is like, we don't like, I actually have, because I don't listen to like Fox News. But I assume that's where I can find all the reasons it was shut down. And I haven't made it there yet. I listen to the New York Times, the Wall Street Journal, and WAPO podcasts every day. The Fox News is in my rotation, but I assume that's where we can find that information.
I'll just say this. I'm not going to go into too much detail to not cause any legal problems for myself. But I would just say that a lot of this comes back to like the people think is the most boring, least sexy, most annoying thing about government, and that is procurement policy. That is those contracts, those agreements, who they're spending money with, what the terms are. This
you know what I'm talking about.
Procurement policy.
That is so sexy. Oof.
I know.
Okay, great. Awesome. Nerdy sexy. All right. Yep. Also, maybe CMS is going to get unalived next week. We don't know. But apparently, even though we've been told like basically our whole lives that you can't access all this data, like I think they just handed it over to the Dozers, the 25-year-olds. Also, I want to be clear. I don't like 25-year-olds are great. Like I was 25 like last year, but like they're just like, have these people ever fired anyone or like done anything really, really hard?
You know, hubris is a big thing. Hubris is a big thing. I also, when I was 25, thought I was hot shit. I was significantly less
100%.
hot shit than I am now, and I'm not even that hot shit. So you know what? Like, it's a problem. It's a problem.
Oh
yeah.
my God. Yeah.
I thought I knew everything in the world. I still do, but like at least I know I didn't. At least I know I don't.
Yeah, I mean, no hate to young people, but there are. I mean, these are all like anecdotal stories, right? About like how these people are just like really unprofessional and kind of awful, and you know,
I'll come back to bite you.
Yeah, I just think there's no excuse for experience, especially when riffing people. Like, yeah, not great. So anyway, but we'll see what's going to happen. I know they're looking for fraud. Lucia Savage, one of our favorite lawyers, one of our favorite like 2 or 3 lawyers from Omada. She's been having some good LinkedIn posts lately, and hers was saying like basically, hey Dozers, like not sure you know this, but there's a team that actually finds a lot of fraud, waste, and abuse. We already do that. So like, I hope you have a good time. So I don't know, maybe they'll find more. I don't know.
Well, my point is that like, it's not that we can't find fraud. It's that it costs money to find fraud. That's one of the reasons why the government putting more money into IRS, are like, if we spend $1 on the IRS, we'll get back like $10 in revenue. But who does that money come from? It comes from taxpayers who have been defrauding the government and like not paying. And those people are also rich in many cases. And they're also the people who donate to politicians and to PACs. And so like, of course, they're not supportive of putting more money into the IRS. And the same thing is for the Center for Program Integrity and the people, across the government who look for fraud, waste, and abuse. Like, you can fund them more and they will find more fraud, but like that's going to make some provider organizations and some payers pretty unhappy because they're going to say like, this was improper. So, it's always kind of a balance of like, who's pulling the purse strings here. This Fraudulent Lutheran Family Services, a, global public health organization whose name happens to be, and their history was from the Lutherans. They got some funding cut, or they were threatened to have their funding cut. They're just doing public health stuff. It's not that crazy. But anyway, like you can find fraud. We know how to find fraud, but like having the political will to actually stop it is a whole nother story. Like, good luck. Go vaya con Dios. Like, I wish you well.
Off we go. Yeah. Like surprise us, right? Like find some crazy shit that we didn't know about, or they're using the AI. Cool. I'm here for it. I'm fucking here for it. Also, just there was I got a note from a fan. I think she tweeted about how she was in the Hill last week. This is Nikita from Fortuna. Very, very positive. Wants to save America. She was in DC last week or the week before, talking about Medicaid. And had tweeted and sent me one of her tweets that was about like, oh look, they say they're not going to cut Medicaid. Y'all, they're going to cut Medicaid.
Sure. Long-standing proposals to put block grants in, which are widely understood to be cuts to Medicaid, extra services, requirements, those are cuts to Medicaid. And there have been like long proposed, long worked on, long favored. I'm glad that Trump, like the President Trump, you know, is interested in Medicaid and services like this. And I really hope that he pushes back and makes sure that there are fewer cuts to Medicaid than there could be, because I genuinely, you know, like, this will hurt people, is already hurting people. Like, I really, like, President Trump, please. I know you watch our show, obviously, because we're so important. Obviously, please, 100%. Like, let us help. Like,
come on our show.
Medicaid. Come on our show, President Trump. Like, please, like, we want to keep Medicaid.
Listen, and that guy, he wouldn't even. You know, a lot of times, like, important officials want to give us talking points, and we say, "Fuck you." No, like, he wouldn't even try. He'd be like, "I'm here." Yeah. Oh man, it would be amazing. Yeah. So, you know, like, yeah, come on our show, tell us about Medicaid. Yeah. And again, it's like, he can say whatever, but yeah, it's like, people are coming for it. So
that's right. That's right.
You know, Lisa, you sent me this little thing on the Bloomberg. It was
interesting.
Long op-ed.
Yeah, so like a weird timing for this op-ed that basically is like kind of going back to high tech, which is now like a bazillion years old, and saying like, oh, we spent too much money on EHRs. And I'm like, it is February 5th, 2025, Bloomberg editorial board. Where have you been? And they don't buy, like, there's no byline. It's not signed. So I'm like, who on the Bloomberg editorial board suddenly learned about the EHR incentive program?
It is funny, because I usually do try to, you know, my shitty screen grabs, I usually do try to make sure I copy in the byline, and there kind of was no byline. No. So yeah, this was kind of silly. But who knows what kind of agenda we're pushing.
Scott says we're going to be in trouble with the president. No, Scott, I feel like we are not going to be in trouble. We can handle. We'd be honored if President Trump would come on our show.
Yeah, absolutely. It would be a great honor. Okay. Also, speaking of President Trump, this apparently, there used to be a 1 for every 2 dereg or whatever, 2 for 1. So now you have every regulation that is. Yeah, that's implemented under the Trump administration, you have to Doge 10 of them. So, yeah, and we had a friend who told us, you know, there's like a way around. This was earlier this week. There's a way around. There's like all these little raisin or other weird regulations, like with fruits and vegetables, that you can just knock off. Apparently, they found that loophole and they closed it. So it actually really is. We have to cut 10 for everyone. Right. I don't know. You know, I'm pro deregulation in general. Yep. Okay. So great. Oh, this is fun. So Lisa, so the past like 100 months, we have heard from at least, actually in the past month, it's been at least 27 white men, all white men, who have told us that they are the national coordinator. They are not the same white man, but 27 of them have told us, and the entire internet, and all of Health Tech Nerds, that they are the national coordinator. What do you think about this?
And we have actually told the world about some of those people and said that they were going to be the national coordinator. So it's like
started some of those rumors.
Yeah, it's like an Ouroboros. Like, we're the snake eating its own tail. But yes, there have been a lot of people in our smallish health tech, healthcare IT world who have informed us, or we have been informed about, or we've informed upon that they are going to be the next national coordinator. And so far, none of them are.
Yeah, so far, none of them are. Also, Lisa, didn't one of them tell you he was the national coordinator and then ask you to send his resume to me to send it to someone else? And we were That's like, correct. You're the national coordinator. I'm so confused.
A lot going on, man. A lot of people are out there recruiting, out there putting out into the wilderness. You know, it's good times.
Oh my God. So rough. I will say this though. So 2 things. If you're the national coordinator, like, and you're really the national coordinator, you're not allowed to post shit on Health Tech News or Health Tech Nerds about how you're the national coordinator or you have the inside scoop, because like that would be like against the rules. Also, remember Don Rucker was telling us about how like he was in the running, and they were like, you better be fucking quiet, right? Like, well, you know, the first time, you better be fucking quiet, right? And so he was like, everybody around me was saying they were the national coordinator. And then like, I showed up and no one expected it. So, I mean, yeah, I think, yeah, Scott, I don't actually know if we will have one.
Yeah, we don't know either.
I think it might be a woman though. I think it also like might be a person of color, which, you know.
Maybe.
shake things up a little. I don't know.
Unlikely.
Who actually knows what's going to happen? But anyway, everybody's so thirsty. So we'll see what happens. I don't know.
Yeah.
Oh yeah. And then speaking of people complaining and like being sad and gnashing of teeth, and obviously Lisa and I use humor as a high defense. But Leslie, CEO of Incenna, my business partner, posted this amazing thing on LinkedIn that I definitely co-opted today with a little bit of spite into it, about like doing good things. So here's the message, y'all. Like, if this is capitalism, like reinvented, with a lot of Republican stuff going on, like you can still do good things. Like, sure, maybe the government's not going to fund certain things that you loved and appreciated, but you still can. And so this is, at Incenna, which is my real job. We put quite a bit of our own money and then quite a bit of company profits into nonprofits. And Lisa does too. You guys, she's like a little bit more modest than me. Lisa actually has a scholarship named after her, I think, at Morgan State. And
it's not named after me. I didn't put my name on it. That's.
Oh, no. I would have. I would have. It's not named after her, but I wish it would be. And she obviously donates to Zoria a ton and sits on our board, and she's on the board of a bunch of other nonprofits. So like, y'all, even if you don't have any money, you can donate your time. You can do all kinds of things to still make a difference and keep things going that you care about. Because like, if you don't show that you care about certain things, no one else will, and then they will actually go away. So be awesome, do the right thing, be American, donate your profits made from capitalism. All right.
That's right.
So that's it for the new show. And now we have very special educational series. Do you want to control this one, Lisa?
Yeah, I'm going to add. There we go. Add stage.
I don't know.
Okay. Okay. So everyone, you know that we are the world's best PR strategists, and we're retired.
That's what I'm talking about.
And because we're retired and we have other jobs, we do this on the side for fun. And I would just like to point out, I'm starting to feel pretty old, because I remember when some of these programs that existed during the first Trump administration were like renamed, retconned into the Biden administration, and now we're seeing some lists of words that we're not supposed to use anymore, and like things like that. And I want to just talk about that because I do think words matter, but also like you can still do stuff and you can be honest about what it is, but you might need to use a few different words. That's okay. Just want to point it out.
Messaging matters.
Messaging matters.
Messaging matters.
So if you go back to the first Trump administration, the direct contracting model is a sort of a form of accountable care organization that was, brought into the public light by my former boss, Adam Bowler, who is now, I believe, the chief hostage negotiator in Gaza.
Listen,
I mean, Mazel, Adam, that's a crazy job. And so, working with him and what he and the first Trump administration were doing was around direct contracting. And then immediately in the new Biden administration, they're like, what is this thing? This is horrible. It is harming patients. Oh my God. Like, it is the worst thing in the world. Medicare is not for sale. Protect seniors and direct contracting. And I was like, oh, wow, that's crazy. What are they going to do? Oh my God.
Direct contracting has a nice, clean Republican feel about it. A lot of business going on there with that term. That's what I'm saying.
And what did it become? It did not go away. It became ACO Reach, ACO Realizing Equity, Access, and Community. And like, what's the difference? Shout out to our friends at Care Journey by Arcadia. They talked about the difference. They changed a few requirements and they added a health equity plan required. Okay. Like, it did not dramatically change. And people were suddenly okay with it and happy about it. And it's all good. And now it's called something else. So like, what's going to happen now? I mean, I assume they're going to rename it again because it's a popular program. It's a popular model. And that's okay. Like, the work still continues. Don't worry about it. Like, find the right words to talk about it. There are some great models and programs that launched from CMS in the last, couple of years. Transforming maternal health model, innovation behavioral health model. Probably KODY can talk about some other great stuff that happened in the last 4 years in a minute. Some of these things are good. States like them. We like states. Don't let the perfect words be the enemy of the good. Like, I understand that it feels really bad if you feel like you can't say DEI or you can't say whatever else it is, but like, the work is more important than being able to say the perfect words. Don't worry about that. I get it. I'm not trying to minimize it, but I'm saying you can still do good work. Please. Like I'm hearing a lot about this from people like, oh, I can't say this. I can't say that. Okay. Don't let the perfect words be the enemy of the good. That's my message in this rant. Kat, what do you think?
Yeah. Yeah. No, I just in general agree. Like, also, like, some of these words still matter, even if you're a Republican. Like, we don't let women get abortions. So, like, we need to have good maternal health care, y'all. Like, that's important. You know, we gotta have those babies. What?
Yeah.
So,
without a doubt. Without a doubt.
I totally agree.
That was like the positive, like, I'm trying to like build you all up and say, like, please keep doing this work. It's really important. States like it. We like states. But then here's my snarky piece. But really,
I have no idea.
But really, what was health equity by design? So one of the things that happens in the administration is like, they're like, everyone's going to do this. And they're like, okay, what do we have to do at ONC around health equity? And they wrote this like big position paper, and they were like asking for feedback. Like, what does it mean for us to design health IT systems with health equity in mind? And, you know, that's fine. I didn't get any meat out of it. I didn't get any like, what are we going to do differently? What does this actually mean? And unfortunately, health equity by design was unalived, as you can see here.
Yeah. Yeah. And we kind of thought for like 20 minutes yesterday that ONC got unalived.
Yeah.
But it came back.
HHS website was down. Yeah. So this was unalived. And you know, that's what's going to happen. Good news is that, like, I don't think that anything really meaningful happened through this work. I didn't get any like, why was this different? Why did it matter? So some things are going to be unalived because the wording is just not going to align with the next administration's priorities. Okay. Yeah. So almost done here. So we do have a humble suggestion though, because
I'm not humble about it. You can be.
I have a humble suggestion.
What?
Okay. And that is, there are some programs people think should continue. There are some programs that are bad. There are some that are good. You all may have heard of the amazing, as we've talked about so many times, the Trusted Exchange Framework and Common Agreement, or TEFCA, is a terrible brand. It is a mouthful. It sounds like you're choking up or something.
It's not good.
Like it's not good.
It's like the Borg. Yeah.
It's not good. It's not the, but yeah, we suggest some like great, there's plenty of great people out to suggest, what should we do? How should we fix it?
Whatever.
We think you should
That's
fix
not what we're worried
Make
about.
it awesome. Make it awesome.
We're not worried.
And
Lisa, I'll say this before you go to the next slide. What do we do when brands get in trouble? Like Arthur Andersen, we rename them Accenture. So Lisa, what should we do here with TEFCA?
We suggest strongly that TEFCA be renamed and rebranded to the Freedom Health Data Network. Once again, everyone. As loyal fans will recall, we provided this free, no-cost, incredible new brand for TEFCA to the Freedom Health Data Network. We are offering this to the government for free, no charge. Like, we strongly suggest you work on replacing every instance of TEFCA with the Freedom Health Data Network. The end. That's our advice to you, loyal fans.
You can even use this logo. You can even do that.
It's great logo.
So we'll make things happen. Really yeah. So last thing that I want to say, it's like semi-serious about all this messaging and stuff, Lisa. So, you know, we talk about how we're PR retired, whatever we are. Here's the thing. We're like kind of still PR girls because you can't get it out of your system. And when Lisa and I are bored, we do spread rumors to the press about things that are likely not true. So, like, it's a lot of fun. Like, you know, we cause a lot of trouble. True. But here's the thing, like and I will say PR girls because we're in the 90s again, and you can say things like that. Right. And most PR people are PR girls. But what everybody thinks PR girls do is like send out fucking press releases and like send shitty pitches to media. You know what real PR girls do? They change your mind. And they do it through all kinds of ways. Yeah. And they might even do it on the Health Tech Talk Show while they're making jokes and making you laugh while you're drinking your wine or whatever the hell's going on. So, but I will say that because you have to keep your wits about you, because there are people like me and Lisa who are spreading rumors that are bad and saying things that are bad. And that's not great. So you got to keep your wits about you. Good PR girls change your mind. Bad PR girls change your mind too. So watch out. Watch out, America.
I mean, on this one, right? Like, I just, you know, I don't want to have to go around and say I told you so to anybody. I would like people to be awesome on their own without me having to say it. So please consider what are you going to do here? Federal government folks, we will literally give you this name and this brand and this logo. We will give it to you. We are not
We'll put it on a t-shirt.
We're not gonna ask, and we're gonna make t-shirts. We're gonna do all this stuff. We are gonna hand it right over. So you just let us know. You might
think it's not serious enough, federal government. However, we have a department that is currently running our country,
Doge,
that we've called Doge, as in the Dogecoin. I mean, this is perfect.
And by the way, we were real early on this one, as people might recall. Yeah, this is not an invention of the last week.
No, didn't we unveil this with Mickey Tripathi and Anish Chopra on the internet?
Yes.
Oh my God.
Yes, we did.
Anyway, that was a little while ago. So that was before meme culture got even really cool in the government. So anyway, all right. Well,
all right.
Lisa, we should probably bring our legitimate guest up here. We probably need him. We
probably do. Kody. Kody. You are muted, Kody. There you go. Oh, there you go. There, perfect.
So what do you think?
Chuckle when you said legitimate. Okay.
Well, I mean, more legitimate than us. Wait, who is this LinkedIn user who says they would like to use our graphic? Please share. Here's the thing. Some of these people value anonymity and security, and it's
no, they don't. No, it's just that the integration with LinkedIn sucks, and so we can't see their name. We can see it. We can see it in the actual thing. Hang on. Yeah.
Whoever you are, LinkedIn user, let us know who you are, and we will gladly send you this amazing artwork.
That's right.
Terry Stewart. There we go. Okay. So Kody, introduce yourself. Oh my God.
Hi, everyone. I'm Kody, and I'm a member of the Gen Z micro-retired group. That's what they call it.
That's amazing.
Micro-retired. I love that. Oh my gosh. That's like when you get when someone gets unalived, like their whole department, or uninvited to their job at the government, now you're micro-retired. That is such a great term.
Never retire in the end. Just take little micro-retirements throughout your career.
Love that. I love that. But you were most recently running healthcare for the great state of North Carolina.
Health and Human Services for the greatest state in the nation, including Canada, North Carolina.
That's what I hear. Because I do think, Lisa, despite what you say about them having all these provinces, their population is as big as California. So I feel
it's not as big as California. That is a correction I'll make for you. It is not even as big as California.
Listen, when I Google it, it says 38 million.
Yeah, we're 40 plus.
Okay, well then that's even more of a case. Then they should just be one state, Lisa.
No, absolutely not. And also, what about the Dakotas? The population of the Dakotas is 1, 2.5. Hello,
well, you know what? I mean, maybe they'll merge, Lisa, so we can only have 50 stars on our states or our
flag. This is my fault. I'm sorry for taking us back to that topic.
Anyway, okay, Kody.
Back to North Carolina healthcare. Yeah, we're doing great.
North Carolina.
Okay, so you did a great job. Everybody loves you. You've been on all the stages. Everybody thinks you're great. What are you most proud of there? Because give us the top 3, because you did a lot of stuff there.
Yeah. So, the thing that most people know about was great is this, we got my last day, 617,000 people enrolled in Medicaid expansion in the first year. Nice. And so, comprehensive healthcare, excited for that. That was a long time coming. Governor Cooper worked for a decade to build a coalition to get that done. My predecessor, Mandy Cohen, big priority for her, but we finally got it over the line, and really happy about that. Number 2, because of the great, what I called signing bonus, we were able to get some money from the federal government when we expanded Medicaid. We were able to put about $835 million of that into behavioral health, pair that with a bunch of policy changes, and try to really change the way behavioral health is done in North Carolina, including a huge investment in data and technology as a way to kind of connect this disconnected system. And that's probably, I'll come back to it, but that's probably my most favorite thing. And then last but not least, we kind of parlayed this deal with the hospitals. We got 99 of all of our hospitals in North Carolina to sign on to this new medical debt relief policy, which forgave or relieved $4 billion in medical debt for 2 million North Carolinians. And then paired with putting in place new charity care standards, and tried to keep people out of debt in the first place, which I really see medical debt as a driver of health in that concept. But behavioral health for me was my passion. I came home to North Carolina in 2018 with the goal to try to make a difference on mental health. And it was a long road, but the window opened in COVID. People came out of that with a sense of connection to mental health issues like they, hadn't had before. And we were able to kind of use that moment and that, newfound connection to fight stigma and to get some stuff done. So pretty fun run.
Pretty awesome.
Medical debt. So I kind of like what you just said there, that you think that's like, a big factor in healthcare overall. I think it's interesting so when I was first introduced to you by our dear friend, Dr. Ann Zink, former CMO of the great state of Alaska, that's how she introduced me. She's like, oh my gosh, you got to meet this guy. He did this crazy thing with medical debt. Like, we're all like, how do we do that? And it's so interesting because it isn't actually something I hear about very often. So can you talk to us about how, I understand why you prioritize it, but how did you prioritize that?
Sure. Look, if you've got $100 in medical debt and, you're a mom who's struggling to pay bills on the fringe, which is the vast majority of folks in this country, I think the current electoral conversations are all pointing as to how frustrated people are with the cost of healthcare and navigating that against the cost of rent and everything else. But if you have $100 in medical debt, it is likely that you're going to think twice or three times before you even go to your primary care visit, because the very first question that you're going to be asked by the folks at the front desk is, do you have your $100 from the time you were in here before, or the time you're in the ED, or your next payment? And, that is enough of a speed bump, even if you can continue on to your appointment, not to go in the first place. And so I think about it in the same context that we think about food, transportation, and other social determinants of health or drivers of health as being a thing that gets in the way of you being healthy. And the thing that frustrates me about medical debt, and I come at this from like a operations and financing background. Most of my government service was actually at the Treasury as a COO, CFO there. As debt ages, hospitals will collect between 1 and 5 cents on the dollar of that debt.
Right.
Yeah.
And they'll hold it on their balance sheet. So we've got, ballooning $4 billion worth of ballooning debt that's rarely going to be collected, but yet the human continues to carry the full emotional and financial burden of that debt, right? And we haven't even started to talk about your inability to buy a home, buy a car, your credit getting ruined, et cetera, et cetera, et cetera. Just the monthly weight of that on you and it keeping you from staying connected to the healthcare system. And so I call it a self-licking ice cream cone, right? It's growing and growing and growing and growing. It never gets paid. It serves no purpose. Nobody wins. And, and we did this big gambit to try to invite hospitals and healthcare systems to align on a consistent charity care policy, to forgive that debt back to 2014, which was the first date that we could have expanded Medicaid.
Wow.
That's
so that
awesome.
we could really give everybody a fresh start. And I think, it turns the relationship from one of collection to one of care with our hospitals. And, two big shout outs here. One is, as we were traveling the state, on the other side of Medicaid expansion, trying to get all 600 and some thousand people enrolled as quickly as possible, people would inevitably take to the podium, tell their story about how they had peace of mind now that they had health insurance, but that they would be, still really struggling to figure out how they were going to take care of that cancer diagnosis bills that they still had from before.
Mm-hmm.
And so if we really wanted to give people a fresh start on this, if we really wanted to try to put North Carolina on a path to people getting healthier, then we had to wipe away this past sin. And then the second shout out is to undo medical debt in New York. They're doing work all across the country and helping health systems. They're either buying debt or getting debt donated, and they were a really important partner to us in this effort.
I have a personal promo here. So this amazing book that I did not write the whole thing of, Artists Remaking Medicine, Emily Peters and a bunch of collaborators. I wrote a chapter in this called Paperweight, which is about sort of the art and the activism around medical debt and sort of the embodiment of that. So you mentioned undo medical debt. RIP Medical Debt is also one of the other companies that's buying debt on the market, essentially for pennies on the dollar, and then forgiving it based on the donations that people make to the organization. It's the same thing, but I think getting to the root of it, which is what you guys did in North Carolina around the charity care policies, like if you're a nonprofit health system or you're otherwise sort of imbued by the state or the government in some way to do this work, like you have to have, and the ACA also requires you to have this charity care policy. And it was just simply not being used, not being communicated, not useful, and all kinds of reasons why people weren't getting the care that they deserved and weren't falling into that. And so I think those kind of efforts to work within the state to say like, hey, what is this doing? Like, what's the point here? You guys aren't getting that money, and people are not getting care, and so then they're getting sicker. Then they're just the Ouroboros of just the self-licking ice cream cone. It's just it's not, we're not getting health at all for this, and the money also isn't there.
Absolutely.
So
And I'll say, in addition to uniform charity care policies so that people can move through the system and understand how it works, but also, frankly, just like ease and efficiency in how these things are applied, right? So, think of everything we can do with data and technology, right? And one of the things that our health systems can do, and they now need to do as part of this policy requirement, is they have to presume people are eligible for charity care. They've got to use their technology to pull their income data automatically, so they don't have to apply separately. If they're in a public program like SNAP or WIC, then they have to assume that we have done their income testing correctly, and they don't need them to reapply. I think what the public wants is for, I like to say plain and simple, the public wants healthcare to be plain and simple. And, we need to be working to yes, use our technology to do billing. Yes, use our technology to drive quality, but then also just how do we make this easier for folks at the point of entry and every step along the way? And that's where we have a lot more to do. And I think tying these technology things with these policies together is a good way to do that.
That's awesome.
Huh. Well, tell us about behavioral healthcare stuff, because I know that was a big thing that I think everybody in the country admired that you all were doing. And you said it's one of your big passions. Like, how'd you get that done?
So, on the other side of COVID, or starting with COVID, everybody experienced loneliness leading to depression. Sometimes everybody experienced fear, sometimes leading to anxiety. You knew someone in your family, someone who maybe was in recovery from a substance use disorder, fell out of their recovery because they lost their job, or they lost their traditions, they lost their connections with folks. And it was real. And people were talking about it a different way. And we're still feeling that. We're feeling that in the conversations that we're having about youth mental health and about people feeling anxious and disconnected from folks. And we set up a series of town halls across the state. We traveled to communities all across North Carolina, and we invited individuals, their families, providers together to talk about what was wrong. And we would bring legislators with us and let them hear the issues, have an open conversation about what we wanted to do. And I'll credit my good friend, Senator Jim Bergen, who's a health chair in my supermajority Republican legislature, who he and I formed a really close relationship, kind of frankly, regardless of party and regardless of interest, to try to solve this problem. And the governor put forward a plan to put $1 billion into mental health, and we got it done. And actually, it's even more than the $835 million that we call for, because much of that, about 200 and some million, is recurring. We were able to increase rates for the first time in a decade. Another thing that I like to point to, coming out of COVID, we had built all of these data platforms to help us track ED utilization during COVID, and who was vaccinated, who was not, how many people were in the hospital, what was going on, managing ICU capacity, et cetera. Hospitals had worked with us to build those pipelines. We're able to pivot much of that into tracking data around ED utilization for psych holds. And also at the same time, the availability of psych beds throughout the state at psych facilities. And we found that on any given night, we would have between 250 and 300 people in an ED that had been cleared medically but in need of psychiatric care. And on the same nights, we have 120 empty psych beds throughout the state. That moved the policy conversation from one in which for the past 50 years, everybody has been just saying, especially from hospitals, like, we need more beds. We can't find a bed. We need more beds. To one where it's like, why aren't we getting people into the beds? And really, it's about the type of bed. Is it a gero bed? Is it a pediatric bed? Where is the bed? And it's really an issue of an acuity and a rate issue, because these providers just can't sustain the staffing necessary at the rates provided to provide the care for these folks. And then it, of course, points the biggest finger at, well, the best crisis system is one that prevents crisis in the first place. So, unlocking that information, I think, helped us drive with public sentiment. And, the magic moment for me was being able to craft a strategy that increased behavioral health urgent cares by 50%, launched, hundreds of millions of dollars for more crisis system investments, put more dollars into our justice involved population to try to help unwind that longstanding stigma of people. 60% of people in justice involved settings, incarcerated settings, have substance use disorder, and, investments in schools, more and more. And almost all of these ideas were mentioned at our town halls. So this kind of like beautiful full circle moment of like the people being able to actually see their work go into it, and for me to kind of help tie that together.
So what do you think
I've
about?
Definitely heard that before. I've definitely heard that before about the beds and the mismatch. So like I'm interested that you guys have been able to find, some kind of responses there, because that's a problem that comes up across different parts of the country as well, for sure.
Yeah, well, so many states are trying to figure that out right now. And how did you all? So you leveraged your COVID bed dashboard, I assume.
Yeah, well, I'll give a happy shout out to Open Beds and our friends at Open Beds. They were an important partner for us. They had, opened up their platform for us to use during COVID, and then we were able to shift it into using it for behavioral health.
And the founder of Open Beds, total lady boss, Dr. Nishi Rawat, do I have the name right? So yeah, like has done cool stuff kind of all over the country. That's awesome. So yeah, I mean, I'm always curious. Like you seem like you figured it out. I think Massachusetts has something similar going on. Arizona, not a lot of states have figured that out.
Well, and Massachusetts has gone to either a step a little bit further than us, and that they're doing kind of a unified point of entry. So regardless of the type of insurance you have, and they're doing an assessment on payers to fund essentially I'd call a 988++ portal, essentially, where everybody can come in and they hand you off and that's like getting better coordinated care at the front door, and then supporting people through that path. Whenever I'm speaking to large groups of folks, I'm like, if the person sitting next to you is having a mental health crisis, would you know what to do? Nobody knows the answer to that. And, we're getting better now with the 988 crisis line, but we have to have much more than even a warm handoff. Like we need a very tight connection, and we still have to build towards that in this country.
So what do you think? You accomplished a whole lot of stuff during your tenure. It's totally awesome. And a lot of it was focused on things that are currently getting doged and the new administration. What are your thoughts on like how we all still do good things without getting doged?
Well, first, I hope you'll help me with this. I'm really trying to make it doggy and not doge. And,
doggy.
Yeah,
See, words matter. You know it. You know it.
Oh man. I'm going to have a hard time with that. Yeah. But I can do it.
Well, and the other thing, so one of the things I did not mention earlier is our healthy opportunity pilots in North Carolina, which are, reducing ED utilization, reducing hospitalizations, and saving $85 per person per month in our managed care costs, because we're giving people access to food and housing and transportation support. So, my headline here, and oh, by the way, these pilots were approved in the first Trump administration. And so I'm, reminding folks that, if you're looking for a way to shift towards prevention by investing in healthy food and important drivers of health, then look no further than North Carolina and look to the success of these pilots that in the first 2 years have had independent, actuarially reviewed, like we are bending the cost curves. At this point, if we remove the pilots, it'll cost us more money in North Carolina. Now, there's lots of things that need to be better around how do they integrate with SNAP? How do we lower costs further? The price per in the food box feels high relatively, but all of that makes me even more excited because we could save even more money by getting upstream and tying these things together. And so, I hope that Doggy won't just burn stuff down, but we'll look to some of the bright spots that I think are there. And I think we need, a chorus of folks, a pack, if you will, to really point these things out. But I worry about it. I'm a public servant at heart. My first job was at the Office of the National Coordinator for Health IT, my first government job. And really smart people doing really good stuff. And I hate this framing that everybody is lazy, because it's just crap.
It's
That's
just not true. That I can say, all joking aside, that is hard, not true. We know so many really, really hardworking government folks who, you know, are doing what they can do within the system and also pushing the limits pretty seriously. I think the healthy opportunities thing, I mean, for me, that is very in the like MAHA universe. That is in the Make America Healthy Again universe.
Yeah.
I can't see why that wouldn't fit right in there and already like meets all, from my perspective, it seems like a perfect fit if you're going to push things around, you know, how we can get healthier food into Americans' households and all like that. I mean, that's how I would sell it if I were the healthy opportunities folks. It is right in that vein.
That is so interesting, you know, because the RFK crowd is like, yeah, like it's a totally different vibe. Like I'm totally here for the CMS claims situation to get doggied. Like whatever, like go hang out with like those claims clearinghouses, go do like, I don't care, go find some fraud, waste and abuse. But like, I do feel like that is a good model. And like, technically it's in the South. So like maybe it all fits in, you know? But yeah, I'm having a real hard time with this doggy thing. I'm like, I keep wanting to say, how do we avoid getting doggied?
It doesn't sound good. It does not sound good. It does not sound good.
I'm going to work on it. I got it.
I
got it figured out. Kody, are you the national coordinator?
Yeah.
No.
Do you want Lisa to call Politico and let them know that
reporting live?
Yeah. She'll do it.
Oh my gosh. No. I think it's Lisa. I think Lisa's been undercover.
Well, you know, we thought that too. We also started a rumor for 48 hours that I was the national coordinator, which like didn't fly very far.
No.
So it could be you. I don't know.
Could be you. Kody
firmly denied.
Kody recently left his job, so I don't know. I mean, it could be it could be that Kody left his job for various other reasons. You never know.
Yeah, federal service. Oh,
doggy.
Okay. Okay. All right. Okay. So say you're not the national coordinator. Like, what are you interested in doing next? It doesn't have to be a job, but like, what areas do you want to focus on?
I mean, look, I think that, you know, we have got to continue to work hard to like fix healthcare. And I know that sounds kind of trite, but you know, I think that it's at a boiling point. I mean, people are so upset; they're viscerally frustrated, and I don't know if we had our finger on it until we saw. I don't think a lot of people that are having these conversations were deeply connected to, you know, just what I think about like kitchen table economics. Like folks don't have $400 in their, you know, savings account. Like an $85 copay to see a specialist, you know, 3 times is impossible, you know, and we've been thinking about cost, but then it's also just like the exhaustion of moving through. And, you know, what's clear to me is that like a system built around tension where you've got payers or providers and everybody fighting with each other about various things or blaming the thing most proximate. You know, it's the bed's problem. It's like, you know, the problem is not the thing right in front of you. The problem is how the whole system is designed and what is not working. And, you know, and people are exhausted by it. And, you know, and I have been thinking more and more about, you know, how do we really hyper focus on the individual and how do we really wrap everything around, you know, removing their risk, right? Like, you know, this idea that individuals, you know, and look, I believe that consumers should be empowered, but when you show up at the emergency department suffering a heart attack, like you're not going to go cost shopping in that moment, right? And so, you know, and your personal responsibility, what is even that concept in this situation that leads you to medical debt so you can't recover it or whatever? So I think we have to kind of reframe the health system and work around that. So, you know, I'm having big ideas, big thoughts right now. I'm working with a number of kind of foundations and associations and various groups to try to kind of keep this conversation moving forward. And, you know, North Carolina, we got amazing stuff done in a very bipartisan environment, right? And I believe that if we can get it done in North Carolina, we can get it done anywhere, and it can have the staying power of doing that. And I hope that after the flash in the pan that is doggy, we can maybe find our way a little bit to to some more meaningful things. Like we need some unconventional fixes. Like we need to touch some third rails here. That's no question. The question is can we grab the right rails?
Yeah. Wow. Kody, you are, I mean, they should, I endorse the new
Kody for
administration.
president.
You. I endorse, a strong endorse here, because you're right. Like, you know, again, North Carolina is you already had to work in an extremely bipartisan way. There was no other option. You guys got some really important things done that were about access to care and improvements to care. And like, that's what we have to do. And then, as I said before, states matter. States like these things. We like states. And so, you know, I think that's where it's got to go in the next 4 years or beyond. Yeah. Vote for Kody, says Kim. We agree.
Vote for Kody. I'm voting for Kody. He's got my vote.
Yeah.
Hey, Kody.
The only voting thing I've been a part of was there was a whole poll on which hairstyle for me was the best. You
Amazing.
can find it on the X or the Twitters or wherever.
Did you add Melissa?
No, I think Melissa added herself. But I'm
Melissa, you're back.
They want to do that.
We got Mary Sarah. Yeah. The
Melissa
Melissa
votes for
approach
Kody.
does work. She's here for it. But
Melissa
hey,
was
Kody,
voting. She was trying to click the vote button for Kody, and she brought herself back on the screen.
That might be. Hey, so Kody, one of the times I texted you, annoyed that you weren't texting me back about something likely trivial, like why aren't you coming to my party? You were like, "Hey, Kat, so sorry. I'm in Western North Carolina where like shit is bad." And I was like, "Oh, whoops." So
yeah, way to be sensitive, Kat. Way to
Wow, Kat. I heard that.
Yeah.
I heard liberals were against North Carolina, but here we go. Incredible.
So anyway,
natural disaster. Kody was doing emergency management.
Yeah, tell us what was going on. What you and your team were able to do. I know things are still not great. So yeah, give us the dirty dirt.
Yeah, I mean, look, North Carolina is no stranger to hurricanes. You know, like I think it's like we're the third top state in the country that gets hurricanes. Like we're very familiar. We have like routine recovery response path, like the department is. But you know, when a hurricane hits mountainous North Carolina, it drops like umpteen trillion gallons of water into the mountains. Those all flow into a little ravine. Like what was the little trickle of a creek behind your home becomes like this massive raging river. Like, and that was what was weird, is like people who lived in low-lying areas near large rivers, you know, lost a lot of stuff, but people who really thought they were safe and who were even less prepared up in the middle of like a holler next to a little creek, you know, I met this one family who, you know, looked out their window at night, turned the floodlight on and go, "Oh crap, we've got to get out of here." And their home, their barn, all their horses, everything gone. And it was just, and it's very uneven in North Carolina. Like there were whole communities that were untouched and whole communities that were wiped away. And so you don't have the kind of collective response of everybody feeling like we're in the same place, you know, and that's what has made recovery really hard here. Building in that topography is really hard. But, you know, I'm really glad to have had the opportunity to be a part of that response. I was on the ground with the governor almost every single day for that month, along with, you know, other members of our cabinet. We were able to bring, you know, the National Guard and the military in, landing C-17s, multiples a day. They carry 15 semi-trucks worth of food and water. They were moved onto Chinook helicopters and taken out to the entire 22 county regions. We had every one of our 22 acute care hospitals back on commercial power within 36 hours. We were able to support the 294 skilled nursing facilities with access to diesel and water. And to me, like Lisa, back to your point, like that's what public service is. And those are what public workers are doing.
Doing stuff for people.
To try to partner with folks to get stuff out. And like, look, when you take a community that has never seen anything like this before, who didn't think to fill up their bathtub with water because they've never had to deal with not having water for multiple days, you know, to have counties that were struggling to be prepared because they had never seen it before. Like the daisy chain of resilience was stretched and it was hard and it was really scary. And I think we'll see more and more extreme weather events like this as we move forward. And the recovery in Western North Carolina is going to be a really, really long haul. But it takes me back to our pilots, which, you know, as we think about food and everything else that drives the health and well-being of a region, we're very lucky that one of our original pilot regions is Western North Carolina. And so places like Manna Food Bank that are handing out
Nice.
food and making that available. Farmers that are getting paid by Medicaid to build networks of care is pretty impressive stuff. But yes, please want to invite. I spent last weekend in Asheville, North Carolina. I was in Ashe County for Christmas. Like, we are open for business in Western North Carolina, so come on down and have 12 bones and enjoy a visit.
Medicaid matters.
Medicaid matters. We care about Medicaid, and we're so excited. And yeah, we're gonna work on alerting the MAHA folks to the awesomeness of healthy opportunities.
Yeah, we potentially know some people. Maybe
we might.
Who knows? No one knows anyone ever, but maybe we do. So Cody, final parting words for our loyal fans.
Goodbye. No.
Doggy.
That's right. Doggy says goodbye.
I think
don't get doggied.
Now is the time when we need to build and maintain community, don't catastrophize, support each other, and stay focused on the horizon of the good work that needs to be done. I do not believe that healthcare is a red issue or a blue issue. It is a green issue. It is highly responsive to financial incentives.
Right.
And we have to work together to try to get those realigned, to make people healthier and to make people happier. And we're doing it. There's lots of bright spots. All of you know what they are. Let's just move this from one of tension against each other to one of collective action and make the difference.
That's awesome. I'm going to totally steal that. I'm sure that sounds like a good classic one, but it's not a bluish or reddish to green issue. I like it. Kat, you should like it too. It's about money. Money is your favorite thing. It's about money.
I love money. I do love capitalism and all the money. So anyway, loyal fans, we're out of time. So loyal fans, all of America who's going to watch this recording, meet your new national coordinator, Kody Kinsley.
Kody Kinsley.
I hear he's starting next week. He'll be there and he's going to do some stuff. So God bless America. We'll see you all.
Thanks,
next
everybody.
Week, right? Yeah, we're going to show next week.
Network.
See y'all.
See y'all. Bye.
Thanks, Kody.
Bye.